Hello, I'm Dr. Livia Santiago Rosado, and I'm the Health Commissioner here in Dutchess County. We have a lot of activities that happen through our health department, but one of the most important activities that we do is around rabies. We are here to talk about rabies prevention and how to keep yourself, your families, and your pets free from rabies, and so that you also know what to do if you may have been exposed to rabies. So please pay attention. We're very excited to share with you this video. Thank you.
I'm Dr. Jessica Galernter, and I work at Rhinebeck Animal Hospital in Rhinebeck, New York. Dogs, cats, and ferrets should receive their first rabies vaccine between 12 and 16 weeks of age. It's then boosted 1 year after that, and then from there it's given either once per year or once every 3 years, depending on the type of vaccine. In New York State, it's dogs, cats, and ferrets. They should be vaccinated for the first time when they're between 12 and 16 weeks old, and then it's boosted 1 year after that. From there, it's given either once per year or once every 3 years, depending on the type of vaccine. So the main risk for them is bats, because there are bats who live in people's houses or can come into the house easily. And bats are not always symptomatic for rabies, and they can bite cats, they can bite us without really showing any symptoms at all. And that's a big risk. So indoor cats do also have to be vaccinated for rabies. The main reason there is bats, because bats can live in houses, they can come into houses very easily, and can bite cats, can bite us, so there's certainly a risk there for them as well.
Hi, my name is Douglas O'Coin. I'm a nurse here at the Dutchess County Department of Health. When you receive the rabies vaccine, your body will begin developing antibodies against the rabies virus. The immune globulin that you'll receive in the hospital will be passive rabies antibody that you receive, which will start working immediately. It won't take 2 weeks to start protecting you against the virus because the vaccine will take that long. It will start protecting you immediately. So this is all part of the rabies post-exposure treatment. When you've been authorized to receive rabies post-exposure treatment, you'll be directed to go to the ER of one of the local hospitals. There you'll get wound treatment if you need. You'll also receive your rabies post-exposure treatment, which includes a dose of rabies vaccine and also rabies immune globulin. The rabies post-exposure includes 4 doses of rabies vaccine, the first at the hospital, and the next 3 over the next 2 weeks, which you receive at the health department in Poughkeepsie.
Hi everyone, my name is Anna Shaw and I'm one of the rabies coordinators here at the Department of Behavioral and Community Health. The powers, duties, and responsibilities regarding rabies are codified in the New York State Public Health Law and State Sanitary Code. The department protects public health, mitigates rabies risk, and partners with key stakeholders in the community to keep residents and pets safe. So we will often issue public health advisories and conduct animal bite investigations to determine whether there is a risk of rabies exposure, and if indicated, we will authorize and administer post-exposure rabies treatment. We also host free rabies vaccine clinics, conduct community outreach, education, and training to prevent rabies. Pursuant to rabies guidelines, a pet involved in a bite incident will typically be placed in a home confinement for 10 days to be observed for signs and symptoms of rabies. People often get nervous when they hear from us. There is a misconception that a pet that bit someone will be immediately taken away or that they will get in trouble, and that's not the case. We only want to keep people and pets safe. The 10-day confinement is typically facilitated at the owner's home. We will ask the owner to keep an eye out on the pet and report any unusual changes in health or behavior to us during that 10-day period. We do ask that contact with people or pets outside the household be limited during confinement. Pets only shed the rabies virus for 3 to 5 days before becoming very sick. So if the animal remains well during the 10 days and is alive after the 10-day period, this indicates that the animal did not have the rabies virus in its saliva at the time of the bite. So we can rule out rabies. That means the bite victim does not have to receive the series of shots to prevent rabies. In Dutchess County, rabies vector species are fox, raccoon, skunk, and bat. The raccoon variant of the rabies is very common in Dutchess County, and so it can still be spread from wild animal to person or pet. It is New York State law that all dogs, cats, and domestic ferrets be vaccinated against rabies by age 4 months. Pets must maintain an up-to-date rabies certificate at all times in New York. Making sure you always get a rabies vaccine for your dog, cat, or ferret is the best way to protect everyone, including your furry friends. Vaccination prevents the reemergence of rabies in the community as well. Fortunately, a rabies shot for your pet is easy to obtain, not too costly, and it's deemed safe. The department offers free rabies vaccine clinics several times a year. You can call us or check our website for clinic dates and events. Rabies vaccinations are also available from your local veterinarian. Hopefully you will never be in a circumstance in which your pet is exposed to rabies, but it's always best to be prepared. Best of all, you'll have peace of mind knowing that your pet and family are protected against rabies. Remember, residents should contact 911 or their local police department in the event of an emergency, such as if a wild animal presents an imminent threat to a person or a pet. And if there's any physical contact between an animal and a person or a pet, report the incident to us, the Department of Behavioral and Community Health, as soon as possible at 845-486-3404, Monday through Friday, 9 a.m. to 5 p.m., or 845-431-6465 on nights, weekends, and holidays. Thank you.
Hi, my name is Jenna Mitchell. I oversee the rabies program here at the Dutchess County Department of Behavioral and Community Health. I'm going to speak to you about one of our resident rabies vector species, bats. The two species most commonly retrieved for rabies testing from our county, Dutchess, are the little brown bat and the big brown bat. Bats do occasionally find their way into our homes, so it is very important to make sure that any holes to the outside are properly sealed. One way that bats often find their way into our living space is through window air conditioning units. Bats are able to squeeze into really small gaps as small as a half an inch, so it is very important that the gaps created when installing an air conditioner are sealed properly. Other ways to keep out bats would be to ensure that open windows have tight-fitting and intact screens, when placing a fan in the window to be sure that the screen remains in place, to keep garage doors and other doors closed when they're not in use, and to make sure chimney dampers are closed. If bats do get into attics, there are proper and ethical ways to remove them. Exclusion can be done at night once the bats leave to forage. However, during the months of June, July, and August, there may be flightless young in the roost. If exclusions are done then, the young will be left without their mothers and will starve and die. For this reason, exclusions should be done in early spring or late fall. One way netting can be used for this purpose, where the bats are able to leave the attic but cannot find their way back in. The New York State DEC licenses nuisance wildlife control officers who are familiar with identifying bat roosts and points of entry. These individuals can provide this service for a fee. As bats are mammals, they are able to get rabies. Only about 1% or less of bats in our area have rabies. Just seeing bats flying around at night does not expose a person to rabies. As discussed, most exposures to rabies are from bites. There is concern, however, for bats that are found in bedrooms with people that are sleeping. If you wake up to a bat in your bedroom, the bat should be safely collected and tested for rabies. Also of concern is a bat seen in a room with an unattended child or impaired person. The best way to capture a bat is to wait for it to land and to place a clear plastic container over it, and then sliding a piece of cardboard between the surface and the container. Then secure the container and cover it with tape. Then the bat can be brought to a veterinarian to be euthanized so that it can be sent to our state lab for rabies testing. If the bat is already dead, it can be picked up carefully with gloves, heavy gloves, or a utensil and placed into a container and brought to one of our health department offices. Just remember, this always has to be pre-scheduled with our rabies team, so please call us anytime a bat is found in your house. So to recap, here are just some things to remember to keep you and your family protected against rabies. Firstly, do not approach or touch wildlife or unknown animals. Also, keep your pets vaccinated against rabies. Work to keep bats out of your dwelling. And most importantly, call our department if you are bitten by an animal or have a bat in your residence.
Hello, my name is Demba Keita. I am one of the rabies coordinators here at the Dutchess County Department of Behavioral and Community Health. Rabies is a preventable viral disease, most often transmitted through the bite of a rabid animal. The rabies virus infects the central nervous system of all mammals, ultimately causing disease in the brain and death. Most rabies cases reported to the Center for Disease Control and Prevention, otherwise known as CDC, each year occur in wild animals such as bats, raccoons, skunks, and foxes. although any mammal can get rabies. Various studies conducted on rabid dogs, cats, and ferrets confirm that when the rabies virus is introduced into a muscle through a bite from another animal, it travels from the site of the bite to the brain by moving within nerves. The animal does not appear ill during this time. The time between the bite and the appearance of symptoms is called the incubation period. And for rabies, this may last for weeks to months. A bite by the animal during the incubation period does not carry a risk of rabies because the virus has not yet made it to the saliva. The virus reaches the brain. What happened? Late in the disease, after the virus has reached the brain and multiplied, there to cause an inflammation of the brain, it moves from the brain to the salivary glands. Also at this time, after the virus has multiplied in the brain, almost all mammals begin to show signs and symptoms of rabies, such as dysfunction, anxiety, confusion, and agitation. Most of these signs are obvious to even an untrained observer. But within a short period of time, usually within 3 to 5 days, the virus has caused enough damage to the brain that the animal begins to show unmistakable signs of rabies. The reason there is so much variation in the time between exposure and the onset of the disease is that many factors come into play, including the site of the exposure, the type of rabies virus involved, and any immunity in the animal or person exposed. The infectious part of the rabies virus includes, first, if an animal is exposed to a rabid animal through saliva or mucus. Next. 2, the rabies virus from the infected saliva or mucus enters the wound or mucous membrane. Rabies virus travel through the nerves to the spinal cord and brain. This process can last approximately 3 to 12 weeks. The animal has no signs of illness during this time. When it reaches the brain, the virus multiplies rapidly and passes to the salivary glands. The animal begins to show signs of the disease. The infected animal usually dies within 7 days of becoming sick. Now, how is rabies transmitted? Rabies virus is transmitted through direct contact, such as through broken skin or mucous membrane in the eyes, nose, or mouth, with saliva or brain, nervous systems, central nervous system tissues from an infected animal. People usually get rabies from the bite of a rabid animal. It is also possible, but rare, for people to get rabies from non-bite exposures, which can include scratches, abrasions, or open wounds that are exposed to saliva or other potentially infectious material from a rabid animal. Other types of contact, such as petting a rabid animal or contact with the blood, urine, or feces of a rabid animal, are not associated with risks for infection and are not considered to be exposure of concern for rabies. But if you are not sure, always call your health department, your local health department. In this case, the Dutchess County Department of Behavioral and Community Health. Non-bite exposures from an infected person could theoretically transmit rabies, but no such cases have been documented. Casual contact, such as touching a person with rabies, or contact with non-infectious fluid or tissues, urine, blood, feces, is not associated with risks for infection. Contact with someone who is receiving the rabies vaccination does not constitute rabies exposure, does not pose a risk for infection, and does not require post-exposure prophylaxis. Rabies virus becomes non-infectious when it dries out and when it is exposed to sunlight. Different environmental conditions affect the rate at which the virus becomes inactive. But in general, if the material containing the virus is dry, the virus can be considered non-infectious. When should I seek medical attention? If you have been in contact with any animals, particularly if you have been bitten or scratched, you should call the Dutchess County Department of Behavioral and Community Health to determine your risk for rabies. Wash any wounds immediately with soap and water, and then plan to see a healthcare provider. It is important to know that, unlike most other animals that carry rabies, many types of bats have very small teeth in which they may leave marks that disappear quickly. If you are unsure, call the Dutchess County Department of Behavioral and Community Health. Thank you.